morning. My eyes was itching all night last night.
Well, the good thing is that we're probably only be here for about 4 hours, so good morning, everybody.
Good morning.
All right, so my name is Eunice. I am an American Heart Association Training Center faculty member, and you all are here for the Basic Life Support Instructor course. And before we start off our instructor courses, we always start off with a skills review, because we find that with instructors, especially if you're not currently in the field, usually that's going to be your weak point. And we don't want instructors who only know how to press play on the video, because what you're doing is you're teaching other people to save lives, and that means that you gotta be on the top of your skills. And so I'd like to start off with our introductions and our whys. So my name is Eunice, I'm a registered nurse. I'm also, like I said, the Training Center faculty member here at Florida Training Academy. And that allows me to teach the instructor courses for the American Heart Association. But my why is because I love seeing new nurses, new CNAs, the light bulb comes on because they've been watching it on TV, but now they actually get to come in and practice, and they're going to be in these environments, home care environments, where they're by themselves. And so I need for them to be comfortable in knowing that they can actually have the skills that will help save someone's life. And if you think about it, how long would it take right now before rescuers get to you if you had to call 911?
Yeah.
Is it 5 minutes? Is it 10 minutes? It's getting longer and longer. And so you are that person who makes the difference. And what you're teaching the people that you're going to be teaching your students is going to be the difference between someone's life and death. And so you really want to take this seriously. So welcome to class. Miss Brenda, would you please, I know I just said your name, but would you please introduce yourself to Nicole and tell her your why? Why are you taking the course?
Hi, I'm Brenda. I'm taking the courses because I enjoy teaching, I enjoy helping, saving lives, and with teaching and saving lives together, that is why I'm here, because sometimes we are the first people on the scene, driving down a highway or a road and someone just collapsed, and we have to be prepared to help save that person's life.
That's awesome, that's awesome. Nicole, please introduce yourself to Brenda.
Hey Brenda, my name is Nicole, and I'm here because I have a need for CPR class in my area. I have a little assisted living and we can't find any CPR trainers, and we have to go out in different county, different places. So I wanted to be certified in order to train my staff so they can get the tools they need to do their jobs.
You're gonna be excellent at it, so very good. May I ask what city?
In Crestview.
Crestview, is that Florida?
Yes.
Okay, awesome, awesome. So let's start with our review. And so the same thing I'm doing here is what I do for every class. So technically right now, I'm not treating you as a BLS instructor. I'm teaching you as a BLS student, because I don't know how much you remember from the last time you took a course, and I always want to go through a review. After we do a review, a verbal review, then we do our skills review. We start off our class with our BLS provider exam. So you're, as an instructor, will be taking the same test that your students would be taking.
Okay.
The reason why we start off this way is because if you can't do the skills, we have to excuse you, because maybe it's just not a good day for you. We have people who have injuries, and according to the American Heart Association standards, if you can't activate the feedback devices. And what feedback devices do the mannequins are required? What are they required to have? You remember when you press, what do you hear?
The click,
The click. And what happens with the shoulder?
the two green lights come on.
Okay, and so all of your mannequins must have feedback devices in order to meet the American Heart Association guidelines. So that click represents how many inches for an adult?
2 to 2.4 inches.
Yes.
1/3 hip.
And if the actual in centimeters, you remember the centimeters, because that's important. You may see that on your test later. 5 centimeters. The reason why you have paper there is because American Heart Association exams are open note and open book. And so if you want to write a note, you can, and that's the same way, again, we treat our regular students. They get to write their notes. But I think you may see that 5 centimeters again, just FYI. Nicole mentioned 1/3. So the side view of the chest, we have to bring it in 1/3 of the way. Why is that important when you're dealing with bariatric or obese patients? Is 2 inches enough?
Not for them. You have to go probably 6 centimeters with them because you have to get through the layers of the adipose tissue.
Yes, yes, yes. So American Heart Association allows 1/3. So for that's all ages. But I really think it's important when you're dealing with somebody who's obese, because you can't be compressing 2 inches. You need to go 1/3. So that was the clicker, the rate indicator in the shoulders. What is the rate? How fast do we compress for all ages?
30 to 2.
30 to 2. What if we're not stopping to give breaths? What's the range per minute?
100 to 120.
100 to 120.
Mhm.
Because you don't have to give breaths. We teach breaths in order to follow the American Heart Association guidelines.
Mhm.
But if I'm in a super center and someone collapses and they're in cardiac arrest, I can save their life by calling 911 and starting high quality chest compressions. I don't have to give breaths in the immediate moments because there's still residual oxygen in their bloodstream. It's just not moving. And when I start doing those chest compressions, it moves the oxygen that's already there. What organs are we trying to save?
We're talking about the heart.
The brain, the heart, everything.
Hey, everything upward.
Yeah.
I like to joke, some of the other stuff probably wasn't working too well anyway. So if you can keep some blood flow going, for every 1 minute that you delay in starting CPR, you're gonna hear 10 a lot. They're gonna lose 10% of brain function. So we didn't find grandma for 2 minutes. She has 80% brain function. We didn't do high quality CPR. So by the time the paramedics get there 10 minutes later, they may be able to use the AED to get her heart restarted, but what has happened to her brain function?
She's lost brain function.
She's lost her brain function. She could be in a vegetative state. So even when you teach in the community, we have like the little inexpensive mannequins, we take them out, the parking lots, the churches. You want to be in the communities teaching CPR, and so that's part of other things that you can do, which may not necessarily result in a payment, especially if you have a business, if you're entrepreneurial, but this is more than about making money, it's about making sure people save lives. And right now, only about, I think the resuscitation efforts from the last study I saw, only about 10% of the victims who sustain sudden cardiac arrest outside of a hospital survive.
Wow.
Because they're not getting bystander CPR.
Right.
The bystanders are so used to calling 911, but now we don't have enough dispatchers. So when you call 911, the first time, they may not answer the phone, or they could be slow to call the phone. So we gotta get in the communities, especially brown communities, and make sure we're teaching CPR, because we're the ones who have the higher cardiovascular disease risk, but we're also the ones who are least likely to know how to perform chest compressions and CPR. So let's go back to those flashing lights. I be getting off track, but I still be on track. So go ahead and flashing lights. Red means dead. Red means you're not going fast enough. Orange means you're getting warm. 2 green lights is the goal. It hurts, so you go really fast. You get 2 green lights and an orange light. That means you're not allowing chest recoil. Which one of you all want to explain what chest recoil is?
Chest recoil is you have to allow the the blood to circulate. You give it a chance when you give compressions and you lift up, and it gives the blood chance to circulate to get to the major organs.
Yes, so I want you to think about like diastole. Whenever you let that heart rest, you let it refill. So yep, so if you go really fast, you as the rescuer are doing a whole bunch of work, but you're not helping that person because you're going so fast, the heart never has a chance to refill with blood again, so they don't have enough volume. Okay, so that will help you whenever you're teaching. You know, if a student's not getting the clicks, well, let me tell you the importance of the clicks. It represents your depth. Oh, you have 1 orange light, that means that your rate isn't up to par. We need you to go a little bit faster. So it's not me, it allows your students to also evaluate the quality of their CPR in real time. Okay, so I'm monitoring and the students are monitoring. For our classroom purposes, we use the tables. Depending on your work area, if you're working with an industrial area, you probably won't be using tables unless you're in the office area. We use tables because we deal with so many nurses and doctors who in the hospital setting, our beds have a CPR mode. And so with the CPR mode, you press a lever, push a button, even if the bed is elevated, the head of the bed will flatten. the air escapes that mattress, you press the button, you call the code, you lower the rail, you get on top, and you start doing chest compressions. So our tables serve as simulated hospital beds that are in the CPR mode. Hi, Victoria, come on in, dear. Hi, come on in. Yeah, good morning. No problem, no problem. So our bed serves as a medical bed that's in CPR mode. Okay, and so, but if you're working in a different industry, that means that your students will have to actually go to the floor. So it just depends on who I'm working with. And then, Victoria, we are recording, just FYI.
Yes, ma'am.
So, any questions on your layout for your particular offices? Like when you teach, you have a conference room?
Well, yes.
Okay, good. And
I
what
do have a
about you?
little
It
training
could be
room.
anywhere on the ground, on the ship, but we will make sure it's a flat surface.
Perfect, perfect, perfect. And Victoria, what about you?
Same thing, conference room.
Okay, awesome. All right, so we talked about the compressions, the rate, the depth, minimizing interruptions. How long can you take your hands off the chest?
No more than 10 seconds, within
No
10
more than
seconds.
10 seconds, because we want to get back to that chest. So, Victoria, it's time for a question. All right, you're by yourself. Forget you're a nurse. You're a patient who's in cardiac arrest, vomits. What do you do?
Chest compression.
Thank you. So your new priority is not ABC. Airway, breathing, circulation is the priority as long as the person has a pulse. So you're taking care of a patient in room 302, his blood pressure is 60/30, we focus on airway. As soon as you have to tap and shout, feel that cardiac pulse, put that bed in CPR mode, we're not focusing on airway anymore. What's our new priority?
Chest compressions.
Okay, and this at the top of your paper, what's the acronym? You want to teach that to your students.
Circulation, airway, breathing.
So instead of ABC, it is now CAB, okay? What does ROSC stand for, Brenda?
Circulation coming back. I know, it's a return of.
If you can cheat, it's on your paper.
I was wrong with my memory.
And so the reason why I have all these acronyms here is because imagine if I have an 18-year-old who was just working at a restaurant yesterday who now wants to be a CNA or a nurse. I need to prepare them for the acronyms before the video starts talking about these acronyms, because the videos won't say, hey, he's alive, it's going to say he achieved ROSC. And I want to let them know what ROSC stands for, the person has a pulse. It doesn't mean they're breathing, but at least we got some improvement, all right? And so VFib or VF is one of those rhythms that the AED is going to detect. So we're back to you, Nicole. What does the AED stand for?
The AED stands for automatic external defibrillator.
Can we use it on a pregnant mother?
Yes.
Perfect, and a lot of your students won't know that. So that is something that I do recommend that you discuss in your classes, because they think that they're going to hurt the baby. Mom's heart is just quivering. It's not producing a contraction. So the placenta that's feeding the baby is not getting any blood supply. So the baby's already endangered, okay? So we wanna make sure we go ahead and use the AED. Why are women more likely to die from sudden cardiac arrest if it happens outside of a hospital?
Well, a lot of.
Because the breast, they don't want to, yeah, they're afraid to touch the
Yes.
breast.
So research has indicated that, especially if they're around males, that they are less likely to receive CPR. Number one, I'm gonna blame it on the media. You never see a woman on TV going into cardiac arrest, because on TV, they don't want to show breast. And then the men will say, well, the Me Too movement. When you're teaching men, it's really important, and I teach a lot of coaches at the colleges and the schools, and I have to remind them that if this 16-year-old, she's an adult, she's 16, she's a high schooler, but she's an adult. If she goes into cardiac arrest on your field, you can expose her chest. What law is gonna protect you?
The,
Good Samaritan.
The Good Samaritan.
law.
If you don't feel comfortable exposing someone's chest, talking about men, what they can do instead is, of course, they're called for help. Hopefully it's a woman somewhere who feels comfortable exposing the chest. You still need to do something. You start CPR on top of clothing. To do nothing, she's gonna end up brain dead, and that's not acceptable. And they have to, of course, expose the chest and, you know, hopefully it has so as to remove the bra. Speaking of the AED, when I go to these different companies, I usually ask them for a image of their AED, so I can make sure I have the make and the model. Because when I go there, they usually don't have training devices, and I don't practice with live AEDs. Plus, you can't get too far without opening up their pads, and then that's a big expense for this
Right.
company. So during my training for American Heart Association, it's gonna help you with your instructor test. If you have to teach something that's non-curriculum, that's outside of AHA, do you teach it before, during, or after your course?
Let's say after.
After or before, you just can't teach it in between. So I let the whole video show, and then, hey, let me show you how to use your AED, and I just go ahead and go to YouTube or something, I've already researched it. But that way they can see how to operate their AED. They're all user-friendly, but some of them, the pads are already attached. They just have to rip open the packaging. But in an emergency, I don't want them always waiting for the nurse. My question to them is, what if it's the nurse who's in cardiac arrest? They're so dependent on the nurse, the safety person. I need for everybody to step up. All right, so another issue I find whenever I go out is that the first aid kits are located on the east hall, and the AED is located at the main door. So what would be your recommendation? You're on site giving a training. This is your responsibility. You have to help keep them safe because they don't know what they don't know. So Toya, what would you recommend? I'm a child care center and I have a huge, I'm gonna say office or building. And it's probably gonna take a minute to run to get the first aid kit and another minute to run to get the AED. What do you recommend?
I would recommend keeping the central location.
Very good, moving closer together, very good. All right, so any questions on that? Whenever a student starts asking me questions about specific AEDs and how many joules, I give them homework. Well, let's talk to your safety person so they can contact the manufacturer, the person they purchased the AED from, so they can give you that information. You don't have to know everything. You have to know what you know, and what I know is how to work my training device. I can only give you the basics about your equipment. So far we've discussed the AED, adult chest compressions, minimizing interruptions. Let's go to child CPR, and then we'll get up and practice. How many hands for child CPR? So that's infant.
Oh, yeah.
So child, you said one.
One.
Can you use two?
Yes.
You certainly can. And so how do you know when to use one hand and when to use two hands? Does it matter?
The size of the child.
The size of the child. I don't want you to be trying to do CPR on a 7-year-old who hasn't reached puberty, knowing that you're not confident in your upper body strength, and you're doing it with one hand. Because what's gonna be your thought for the rest of your life if the child doesn't live?
Oh, gosh, you didn't do it.
You didn't do enough.
Yeah.
So when in doubt, use two hands, and that's on anybody from 1 to puberty. My son is 11, he weighs 132 pounds, and he's 5'2". According to American Heart, is he a child or an adult?
An adult.
He's an adult. I don't care if he has on a SpongeBob t-shirt, he is an adult, okay? And I need you to compress 2 inches, and the numbers don't change. For a child and for an adult, it's the same exact numbers, 2 inches, 100 up to 120 compressions per minute. If you are giving breaths as a single rescuer, what's the ratio?
1 to 6 and an adult.
Oh, I apologize. If you're giving breaths, what's the ratio?
Breath.
30 compressions to 2 breaths.
Two.
Now let's talk about what happens when we have multiple rescuers for a child or an infant. What's our ratio?
15 to 2.
Why?
Because you need, to give more,
It's not the compressions,
Oh,
it's not the
it's the
compressions,
breath.
it's the
Breath.
breath.
because with a child, it's
The lungs.
the breath that usually
I know
it's
what you're trying to say.
respiratory,
Yes.
respiratory or circulatory that would cause
The
the cardiac
Mhm.
arrest, so you wanna give the breath.
Yeah, so when you do the math, when you're doing 15 to 2, for 2 minutes, you're actually end up giving 10 cycles. And so that means you're giving 20 breaths instead of 10, so you give double the amount of breaths, but you can only do that if you have help. If you're by yourself, you keep doing 30 to 2. Most of our textbooks are geared to a Western culture, and so on the video, it says that you do not wait for a child or an infant to have a pulse, to be pulseless before you start CPR. What are the parameters to start CPR on children and infants? We don't wait for them to be dead,
No, right away, even if they have a pulse. it's
but
still-
what's the parameters? Like, cause you have to know your numbers, because according to the American Heart Association, that's how you wanna say everything. According to the American Heart Association, We can provide CPR on an infant or a child if the heart rate is less than
60.
60
Oh, 60.
with signs of poor perfusion. And when you say signs of poor perfusion, all of your students are gonna say, turning what color?
Blue.
Black people don't turn
I
blue.
know.
So as an instructor,
Right.
this is your time, and I tell them, like, it's really odd, it's kinda like a grayish color,
Yeah.
and then on the video, it may talk about gums. African Americans usually have naturally dark gums.
Mhm.
And if I don't have on gloves, I'm not going into your mouth in an emergency, so I would never look at your gums.
Yeah.
What would you ask your students to look for that's quicker?
Fingertips.
Fingertips,
Mhm.
capillary refill. And if they don't understand what capillary refill is, just have them press, okay? And if that blood doesn't return within 2 seconds, that would be a sign of poor perfusion. Cold hands are a sign of poor perfusion. So you don't have to be worried about the coloration of the face as much. You can just tell them to go to the hands, especially with somebody who's a brown skin tone. All right, so then we talked about rescue breaths. With the advanced airways, oop, I gotta backtrack. So you all can go to Narcan.com, they usually have like free Narcan trainers. It may not be worth the wait. You have to wait like 6 weeks, or you can just go on Amazon and spend $10 and get your Narcan trainer. Sometimes the fire departments may have Narcan trainers. Why would you be administering Narcan?
For an opioid overdose.
Do not assume that the person doesn't use drugs. Because we have a lot of professionals who are using drugs, not just people who are on the street or homeless. And so if you administer it, first of all, the person still has to be breathing. Because this is inhaled, and if they're not breathing, it's not gonna go anywhere. So this person is unresponsive, struggling to breathe. If you have Narcan on you, you're going to utilize it. You can just squeeze a nostril, insert, and press the plunger. What they don't tell you is that if this person wakes up, they don't wake up happy.
Great.
So it's rage mode. You need to be prepared to protect yourself and try to talk them down. Sometimes it takes more than one dose. What I've heard from a local firefighter is that because the drug dealers were selling you the drugs and the antidote, they flooded the market with Narcan.
Oh.
So if this person has overdosed multiple times, but has also used Narcan multiple times, this one dose isn't going to impact them, it's not enough. So sometimes they need multiple doses. So you're gonna be making sure that you have 911 en route, okay? And so the video will talk about Narcan, but it's talking about it, but you don't really have the device if you don't order it separately, because it does not come with your equipment kits. Advanced airways. Video's gonna cover that also. So advanced airways, tell me a type of an advanced airway, Satoria.
A, pocket,
Advanced airway, something
a
that's
trach.
a trach. So if somebody has a trach, so a trach, an intubation tube, depends on where you are. In hospitals, we have more, I won't say more permanent, but they're going to be usually, not super gothic above. So your paramedics will put like an LMAs and your combo tubes. Those are easy to put in, easy to take out. We're going to put like an endotracheal tube in the hospital, and that can stay in until we decide if we need to trach the person. If somebody has an ET tube or a trach, how do you ventilate them?
From the trach.
And I see her over there, she's taking the mask off. It may be hard to take off. These are old.
Yeah.
Let me help you. There we go.
And you put this inside
Yes.
the endotracheal tube.
So I'm gonna pretend that I'm right here. He has a trach. He's,
Put it on.
and so someone's doing chest compressions. How frequently would I give a breath if someone is intubated, if they have an advanced airway? Continuous chest compressions.
Right.
How often do you give a breath?
6.
One every 6 seconds, okay? And so usually it's respiratory therapists, they're here at the bed and they're doing their own count. Meanwhile, that compressor's going continuously at a rate of 100 up to 120 per minute. How often do we switch out?
Every 5 cycles.
Every 5 cycles, or how many minutes?
2.
And usually respiratory therapists, they don't switch out.
So, I have a question, I'm sorry.
Yes, no problem.
So, I didn't set it up really well. So, while you're doing the chest compression, you're doing the 6 here at the same time?
Yes, and the reason why you're able to do that is because it's usually inflated. It has a tube, so the air, and then we have this connected to the end of the tube, so it has positive pressure. And
Gotcha.
so it's the breath, the air is staying in the lungs.
Yes.
The reason without an advanced airway, we have to stop and do 30 compressions followed by 2 breaths, because if you're trying to breathe at the same time I'm compressing, we're just gonna push the air out, but the air is gonna remain trapped due to what reasons? The trach, and what's special about the trach, what's at the bottom of it? The balloon, the cuff, and then because we have this connected, we have positive pressure. So the air can escape, doesn't have anywhere to go. It's either gonna go in the lungs or back into this bag.
Actually, go straight to the lungs. Okay, that's okay. Makes sense.
All right, let's go ahead and, let's start practicing. So I'm going to ask Victoria if you'll come over here. All right, if I can get you over here. And then I'm gonna partner you with Ms. Brenda, so come on over here. All right. So Victoria, I will be your invisible airway person. All right, so if I can get you please to go ahead and pick up the bag from Nicole. So Nicole, you're not on the scene just yet. You're gonna be called to the scene, and when you come to the scene, you're rescuer number 2. I'm gonna be your rescuer number 2, but because I'm monitoring this station, it may take a while before I get to you.
Okay.
All right, so rescuer number 1's, your job is to do the assessment, to call for help, and then to start chest compressions. And the sooner you can do all this, the better. All right, so please make sure your scene is safe. Look left and look right. All right, check for responsiveness.
Hey, are you okay?
No
You
response,
okay?
go ahead and call for help now.
Hey, can you go get help?
You go get an AED.
Call and get an AED.
All right, good, now we're checking for what 2 things simultaneously?
Pulse and breathing.
For how many seconds max?
No more than
10.
No more than 10. There's no pulse, there's no breathing, what device, if we haven't called for it?
AED.
AED, hands on the chest, avoid the xiphoid process, good job, let's start compressing, let's go 30. Go ahead and get in place. Put the mask on, don't wait, no delays. 13, 14, 15, 16, 17, 18, 19, 20, 21, turn the mask around. 24, 25, 26, don't stop, your team hasn't come yet. 1, 2, 3, 4, it's time to say, that's not fast.
9, 10, 11, 12, 13.
And that's when your team is here. Your team is here. 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Compressors hover, raise your hands, airway. She has to see the breaths. 1 and 2. Sorry, I'm delayed over here. Let's go. 1, 2, 3, 4, 5, 6. Count word, Nicole. 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 20, and hover. 1, pretend it went through, there we go, and 2, that was not going through, pause everybody. We have 10 seconds to switch. 9, 8, 7, 6, all right, compressor, get in place, let's go. 1, 2, 3. Nicole doesn't like to count. Nicole, 11, 12, 13, 14, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and hover. 2, good job, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and hover, Nicole, hands up. Great job, you all can stop. Great job. All right, and you all can have a seat, there's sanitizer at each station. So you all call for the AED. When the AED arrives to the scene, what's the first thing we do?
You
Turn it on.
Turn it on, and then to make sure your students pass their exam, they don't need to do anything else except for listen. You need to follow the prompts, because these are automated, they're voice guided. If you just do that, it's gonna tell you what to do. I don't wanna turn it on right now, because our person has a hairy chest. How do I address it?
If you have any, thing to shave,
Perfect, and so when you're teaching students, if they're shaving, what should they have on their hands?
gloves,
Gloves, to prevent what?
blood or any infections?
Perfect. Let's say that we don't have a razor in our AED kit, but we have an extra set of pediatric pads. We're not gonna waste our adult pads because we need our adult pads on this adult patient. What do we do with those PD pads?
You put it on the chest and you pull off that hair.
Okay. And so, if they move, you did a good job. You don't need to do CPR. Alright. Our patient has a fentanyl patch on, and we don't have gloves. Doesn't matter the medication, but this just happens to be fentanyl.
You're gonna have to wipe that out, make sure you have gloves
No,
on.
no, no.
But what if I don't have gloves?
You cannot, put it over the patch.
You gotta
You have to move that and wipe it off.
What do I move it with if I don't have
have a
gloves?
A piece of cloth,
So
a
it has to
towel.
be something that's plastic.
Oh, plastic.
So garbage bag, doesn't have to be all that clean, the
For
Walmart
the
bags
fentanyl.
Mhm.
for us. Because if it's permeable, like this shirt has pores,
Right,
I'm still
It's
going
gonna
to
go
get
through
it
the
on
skin,
me.
right.
Yep, so you wanna have, and so you wanna be teaching this to your students. I recommend everybody have like a first aid kit in their car, but chances are, if there's an emergency and you got the first aid kit, it may not happen, cause you happen to have a first aid kit, but I do keep one in my car, I keep one here in the office also. And, actually, when I had 2 vehicles, I had one in each vehicle, because I would just never want something to happen and I wasn't prepared, right? So, we talked about pregnancy. Yes, you can use the AED on a pregnant person. What do you do if this person drowned? And we pull them out of the pool, what do we do before we use the AED?
right.
So you said what?
Just wipe the chest.
Just wipe the chest.
Mhm.
And then the puddle of water that has accumulated around them, water is a conductor of electricity. So you don't wanna be standing in that puddle when you press that shock button, because you're gonna get shocked too. Stand outside the puddle or do like a foot drag and move them a little bit down, because you don't wanna accumulate a puddle of water and electricity at the same time. Any other contradictions y'all can think of, contraindications? Bras, what do you have to do with that?
Unhook it.
Unhook it, or if you have the scissors,
Cut it off.
cut it. How do you know if somebody has an implanted device such as a pacemaker or defibrillator?
You can see that box through the skin.
So I'm teaching a class, it probably had like 60 people, and there was a guy there, he's joking with all his employees, coworkers, he's like, hey, just letting you all know, I have a defibrillator, so you all don't have to use the AED on me.
Oh,
You
yes,
gonna
you
go.
do.
Goodbye.
But that was a good teaching point, because I would not have known to explain to people that even though you have an implanted defibrillator, the batteries die.
Yeah.
And so we're still going to, because we always think about pacemaker, well, now they're combos and everything else. So you still want to apply the external defibrillator AED, even though someone may have an implanted device. You just can't put the machine or pads directly on top, okay? And good thing, unless your heart is like not positioned properly, usually the AEDs and pacemakers go to the left, and your pads go low left, high right.
Mhm.
Your students will do this. How would you correct them?
Lift it, come up below the breath,
Okay.
the nipple.
And why are we lifting it to bring it, so high up? What is there? It's a reason why. So the apex or the strongest part of the heart, so when we think of a heart, it's actually opposite. So the strongest part of the heart is here. That's the ventricles. That's what the pump, that is the kick that sends the blood out. So we're usually putting this at the base of the breast line, okay? We pill and stick. I haven't turned the machine on yet. The machine is on. It is going to say connected. And notice how I'm doing all of this without turning the machine on, because if I try to talk while the machine is on, that's a distraction. And it's now saying analyzing heart rhythm. If I am touching while it's analyzing, it's going to pick up my heart
pulse.
rhythm. So what do I have to say?
Clear.
Clear. Everybody clears. This is when it gets tricky, because we have basic life support providers using an AED as if it's a manual device, the one that's on top of the crash cart. Your cafeteria workers, they need to use this AED exactly as it says. When it says stand clear, do not touch the person, don't have them go back and do what I'm teaching you now. What I'm teaching is for basic life support and ACLS providers. As a BLS instructor, you can teach heart saver or lay persons. Do not confuse them, don't complicate their life. So this is what the machine's gonna say, analyzing heart rhythm, we're gonna say clear. It's gonna say shock advised. We're supposed to go back and do compressions. now it's charging. And then it's gonna flash, and it's gonna start making noises, which tells you it's fully charged. What do we say before we press that button?
Clear.
Clear. We press the button, usually the person will jolt because they're getting some energy, and we go right back into chest compressions. If you're with the audience who would never be in that leadership role, I need them to use the AED exactly as it's stated. So Victoria, would you please come over here, dear? We're on the unit today. All right, and if you'll please work the AED, just gotta press the button real hard, well utilized. I'm gonna do compressions, I only move when you tell me to, and I only listen to you, so you go ahead and press it.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Gotta listen to the prompts.
Apply
Apply pads.
Apply pads. Plug in connector.
Work around me.
Apply pads. Plug in connector. Analyzing heart rhythm.
I will listen to you.
Do not touch the patient.
I was waiting for her to say it.
Shock advised, we don't look at dead people. What do you
Charging.
do? Say compress.
Compress.
Don't
Stay
move
clear of
until it
patient.
flashes.
Deliver shock now.
Clear.
Press the orange button
Look around,
now.
somebody down there
Everybody
touching.
clear?
Okay, everybody clear now.
Sure.
Shock delivered.
We don't look at dead people.
Begin CPR.
Okay. What's that tone called?
That tone, that's the heart rate.
Mm-mm.
Better, sorry.
Everyone say metronome.
Metronome. Yes.
What's the purpose of the metronome?
Alert.
They help you with the pace of
Help you with the pace. So when your person's going too fast, you tell them to compress with the metronome. Would you go ahead and turn it off for me? Thank you, give her applause. Great job.
Put it back
I know,
on.
I'm sorry, I know what I'm talking about, I just can't get it all. I can get the first half of it because I know what it's.
So those are terms that you have to know, because your video is going to mention it, your book mentions it, and what you don't want as an instructor is for your students to be smarter than you.
Right.
So when the video says a word that you've never heard before, you gotta research it, because that's gonna be the one word a student go ask you, like, what does this mean? Like, man, Eunice told me this. All right, so what is it called? The tone that the AED makes?
Metronome.
Metronome, what's the purpose of it?
To keep you, the compressor to go with the beat of the machine.
Perfect, and if you, were looking at the, feedback devices, every time I compress, according to the
The
metronome,
two
I
lights,
get the
green
two
lights.
green lights. For classroom purposes only, we turn off our AED. So that's something I used to require our students to say, our instructors to say. For classroom purposes only, I'm turning off the AED. Because I told you, we have 18-year-olds in here, 17-year-olds in here who just left the restaurant industry, going into healthcare. I don't ever want them to just turn off their AED, because we did it in a classroom setting. When would they turn off their AED?
When it tell them to. Oh, when
EMS comes.
EMS arrives.
What I'm thinking, you do whatever the AD say, but the AD is not probably not gonna say
Yeah.
turn
And
off.
so, and DeMar Hamlin, when he was, shocked on the field, they got him back in the ambulance,
Yeah.
according to reports, he regained a pulse. If we take it off or turn it off, we won't know that he lost it again,
Right.
so he had to be coded multiple times.
Right.
You will keep the AED on, it's gonna keep analyzing how many minutes, every 2 minutes. If you're doing your compressions, how often do you and your partner switch?
5 seconds.
Which is how many minutes?
2 minutes.
So pretty much every time this reanalyzes, y'all switch, okay? What questions do y'all have about the use of the AED? Hey, everybody on your own body, show me how to help a choking victim. On your own bodies.
The trust.
Your choking victim hurt.
You feel for the navel, you feel for the navel.
Navel.
The navel.
Okay, so let me show you.
So
You have to make like a fulcrum, you make a point. So the knuckle of your thumb,
Yes.
look at me, I'm way down here. Make it tight, make a fist, put your thumb in.
I did one now to get it out.
She like, look, I did something. Alright, and so that Your free hand, you're gonna cup.
Mm-hmm.
And so this makes a point, and now you do what type of thrust?
The, something that thrust.
Up.
The upper thrust, what is it called again?
Thrust. So we don't call it the Hamlet maneuver, because the Hamlet family suit is now called abdominal thrust.
That's right.
Oh,
Oh,
Yeah.
you don't do the arm one no more.
So you
Okay.
do it, you just can't
No, you
say
don't, you don't
that.
say it no more.
Kind of
Thank
like
you.
that, the performer formerly known as Prince,
right,
he's still Prince,
right.
but we have to say formerly known as Prince. So the abdominal thrust, previously referred to as the Heimlich maneuver, okay? And you do upward and inward thrust until what happens?
Until the,
Object is
Expelled.
Or,
The person go unconscious.
and if
And
you
you
don't have a
start
tight
CPR.
hold, they're gonna fall face forward. So you have a grip on them and you start stepping backwards and you get them on the floor. Of course, you call for help, and within 10 seconds, you should be starting your chest compressions. Every time you would go to the mouth to give a breath, whether you're going to give a breath or not, you will look for the obstructing object. If you see it, you can remove it. If you don't see it, if you want to give 2 breaths, you can. Not a requirement if you don't have your PPE there yet, your breathing apparatuses. But every time you would go to get a breath, you can look for the object. How many seconds do you get max?
10.
10 seconds, go back to that chest. And someone's like, well, he's choking to death. He has already lost his oxygen supply, but there is still oxygen in his body. My goal right now until the paramedics get there is to keep that blood circulating. Once they get there, they can sculpt, they can tube, they can do whatever they need to in order to supplement his oxygen levels. You got it?
So I was
Got
gonna
it.
tell you, I have a patient that no matter what we do down here, it wouldn't come out. It's on the hair. I
But you're
stress
going
it
right
out.
here, so let me tell you like safe
Yes,
zones.
and I get it all out. I'm telling you.
Safe zones versus unsafe.
Yeah,
So make a diamond above the belly button.
a diamond, got you.
That's safe.
Yes.
Flip that diamond.
That's unsafe.
That's unsafe. That's where the xiphoid process is.
Yes.
Okay, so we can compress. Or
No, not the chest. Yeah.
Yes, you can.
Oh.
If they're pregnant or they're obese,
Oh, you can do the chest too?
you can
for
do the chest, but it's not up. Well,
It's
I
down.
should have to watch you do it.
Yeah, yeah. You're
still-
talking about this one?
No, that's the xiphoid process.
You're talking about this one?
So, but if they're pregnant, you can't be on their stomach.
Right.
Center of the chest. I gotta see you do it. And you go straight in.
And for the
And
pregnant.
so that
okay.
person who could be obese or wheelchair bound, and you can't get your arms around him to get to the stomach,
That's what it was. Yes.
you're gonna go here.
It's the wheelchair. Okay.
Okay, I got you, we
Yeah,
got
it's
this.
it's the wheelchair. Okay.
But
Okay.
remember, we can't compress where, because your students are gonna watch you. We
Yes,
can't
I'm
compress
gonna
on the
watch you.
xiphoid process,
Mhm.
okay? All right. Infants, we pass out one more infant. We'll get this infant to you. It's a big baby.
Maybe it's
We'll get this infant to you. I need,
So we don't call it diamond because you said they've been sued.
uh-huh.
Thank you for that. I
You're
didn't
very
know that.
welcome.
Yes, I didn't know that. Okay.
Alright, so everybody kind of like turn to the side, because you don't want your baby's head hitting the table. We gotta help protect the baby.
I just wanted to make sure.
No problem. Alright, so it doesn't matter what side you turn to, but you want, how Satoria's using her leg. Alright, and so head should be facing the palm, the baby's head should be facing your palm. Look at me. I got the baby on one arm.
Oh,
Your baby should be, but the head is towards the palm. Legs across the arms. Awesome. You're not suffocating the baby. This baby was choking, okay? Your hands are open, or there's an air pocket, or you can do like Miss Brenda, she just has that, her hands on the neck. But
oh.
either way, we have to support their head. For what reasons?
So no neck damage.
Yeah,
No-
they have the bobblehead sending the heads bring their body, so you gotta, there we go, straddle. And now, once the head is lowered in the diaper, where do we get the baby in the back?
Back thrust.
Back thrust. So, look at them versus what you just did. Do it again, Satoria.
Oh.
Head should be lower than the diaper. Turn, face Satoria. Turn.
So-
Use your legs. The baby's almost bigger than you. There we go. Alright, and so, you're dislodging. Let's go 5 times. 1, 2, 3, 4, 5. Support the baby's head and spine. Rotate to the opposite arm. 2 fingers on the chest. Chest thrust, let's go. How should the head be, Nicole?
Down.
Down, use your leg.
Oh.
1, 2, 3, 4, 5. Let's do it again, let's go. Back. Let's do it again, let's go, chest. Nicole, we gonna take your baby.
You see everybody. Hold on. 2, 3,
4, 5, support and back, let's go. So I see what you're doing. You're so concerned about arms and legs that you're not focusing on your airway.
Okay.
Forget those arms and those legs, trying to get them positioned perfectly. So, babies, here, let's do 5. We got 5 seconds, let's go. 1, 2, 3, 4, support and flip. Don't worry about the arms, let's go. 1, 2, 3, 4, 5. Great job, everybody, look in the mouth. Don't put your finger in our infant's mouth, but show me which finger you would use to retrieve the object.
Oh, the pinky.
And then do you go straight in?
No.
It's always curved, and you can only do that if you see the object.
No blind sweep.
None of us have on long nails, which is perfect. Your students are gonna come in and they have on long nails. So there have been instances where more damage has been caused by the fingernail than by the object. So if you have to do any of this to an infant, you need to go ahead and take them to the hospital. Plus, the infant could have swallowed 2 items and we only got out 1 item.
Yeah.
I have bad news for you all. Lay your infants down and stop moving. There's a button on the diaper. Go and press that button. All right, 2 fingers, infant's nipple line. Or you can do the 2 thumb and circling hand technique. Let's start with the 2 fingers first. Let's do our 30 compressions. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Most of us are healthcare providers, so we're taking this course for our jobs. If this was a baby that you did not know, because moms won't tell you their baby had a fever of 105 for 4 days, they're just gonna bring you a really sick baby.
Yeah.
You don't be putting your mouth on everybody. If you don't have your protective devices, your pocket mask, you just keep doing your chest compression. So look, she's pulling out her keychain. Look, I keep it on me. But where would your mouth go in relation to the infant's face?
Over the nose and the mouth.
Over the nose and the mouth. And so no squeeze of the nostrils, you're just gonna put your mouth over their nose and their mouth, and you give a baby breath. We use a term called blowing or popping a lung. I don't think you can really pop the lung, but what you can do instead is put so much air in the chest cavity, in the lungs, until your CPR quality won't be effective. So you give a baby breath. So after 30 compressions, you give 2 baby breaths. If you are unable, because some of your students may have arthritis, I've had students who have missing fingers. They can do 2 thumb encircling hand technique instead. And this sometimes is easier if you go ahead and stand, because the baby has to be on a flat surface. Alright, so let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. Let that chest recoil, Nicole, all the way up. 7, 28, 29, 30. Awesome. So if you're by yourself, what's the ratio for an infant?
30 to 2.
30 to 2. Your team member just arrived, and so I'm going to put you 2 over here, please. So, Victoria, if I can get you to come around. Let's get you over here. If you will turn this back on, please. I think I powered them off. All right, so rescuer number 1 would be Victoria and Nicole. If you all will go ahead and do the 2 thumb encircling hand technique, wrap your hands around. Awesome, and then you and I, because we're not gonna do the scene assessment for this one, they know how to do a scene assessment. You're gonna go ahead and put the mask on, and we have to stay in place, you all, and we don't wanna hyperextend the baby's head or airway. And these mannequins, I don't make them, I buy them. They are extremely difficult to ventilate. So if this was an infant who was hard to get a breath through, what would we do? We wouldn't keep using this, what would we do instead?
Breath.
How would we give the breath? If we,
device?
We would intubate them. Okay, so when you call 911 and those paramedics come, if they're having a hard time bagging this baby, they're going to put a tube so it'll be easier so they can get those breaths down, okay? So if your student's having a hard time bagging, just let them know these are some difficult infants to bag with, okay? All right, so let's go, 15 to 2, let's go. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Thumbs up. 1 and 2. Let's go again. Good job. Go down. 10, 11, 12, 13, 14, 15. Thumbs up. 1 and 2. After this one, you all have 10 seconds. Let's switch. 10, 11, 12, 13, 14, 15. 10, I'm doing it. And now we have 10 seconds to switch off. 9, 8, airway, get in place as soon as possible. Let's go. 1, 2, 3, 4, 5, 6. Open up the airway. 9, 10, 11, 12, 13. Open up the airway. 15. So if you open it, you keep it open. There we go. 1 and 2. Give it 2 breaths. 1 and half squeeze. Good. Keep it open. 11, 12, 13, 14, 15. Perfect. If everybody would stop. The AED just arrived. Miss Brenda, you take over. All right, so you all, if you look at this station, I'm gonna be over here doing, Aisha, Satori, would you do compressions? Okay, let's go. Okay, just step over a little bit, step over a little bit.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Turn it on, yes, you're by yourself,
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
23, 24, 25, 26, 27, 28, 29, 30.
Analyzing heart rhythm.
Clear.
Clear.
Do not touch the patient.
Be careful, Miss Brenda. There we go. When it says analyzing, what do you tell her?
Shock advised.
Go ahead and do what she says.
Continue
Uh-huh.
CPR.
Charging.
She'll tell you when to move.
Stay clear of patient.
Clear.
Clear.
Deliver shock now.
Everybody
Press
clear?
the orange shock delivered.
Good job.
CPR.
Let's go back.
Begin CPR.
4, 5, 6, 7, 8.
9, 10, 11, 12, 13, 14, 15. 2 breaths, thumbs up. 1 and 2. Great job, everybody. Now, for our students, what do we say before we turn this off?
That you only take it off until the advanced life support gets here, and they'll use their own pad, never remove it.
So I'm gonna simplify it for you. We're turning this off for classroom purposes only. All right, so there we go. Great job, everybody. So that was our quick review. So now that I know you know your skills, now we can go ahead and give you a quick break. And then after your break, we can start our traditional basic life support instructor course. So we talked about our why. So Satoria, would you give us your why? Why did you become a BLS instructor?
To save lives.
To save lives. And how has it been? How long have you been an instructor now?
2 years. Feels like forever though.
Yeah, because you had to go through a whole pandemic, and it's been crazy. Did you teach during the pandemic?
I did.
I didn't stop either, so we just kept. So I went and got my vaccines only because everybody who walked in still had on their work uniforms. I thought I was safe in here with my mannequins. I was like, oh, you just got the COVID unit too. So yeah, let me go ahead and get those vaccines. All right, and so now I want a takeaway. What I used to do at the end of my courses is I always ask for a takeaway because I'm training people who have years of experience, and I always want to add value. Otherwise, there's no reason for me to be here. And so would you please give me a takeaway? A takeaway is something that was reinforced because you knew it before but maybe forgot it, or something that you've learned. Would you please give us a takeaway about the BLS instructor process, the teaching process from what we've covered so far today?
Just because you have been doing this for years, if you don't use it, you can lose it. So it's a good update to keep current with all of the science that's going on with AHA and the BLS course. And so it was a great refresher for me.
Perfect, thank you. Satoria?
The refresher for me, I would say, was definitely the acronym.
RSC.
Lots.
All right, and so again, those students, they're asking you questions, so you gotta make sure that you're prepared for those questions. And the way to stay prepared is by reading those manuals. And then would you please give us a takeaway?
For me, was some of the terms, like the IMAN, it's no longer the IMAN, and that is a good update for, because I was always referring back to the old ways. And some of the different terminology, I forgot them and position, so it helps me to be current and updated in all the different levels of the cardio resuscitation process, including the AED.
Perfect. Oh, what does CPR stand for?
Pulmonary resuscitation.
Only about 10% of your students are gonna be able to answer that question. That's usually the first question I ask, because all they know is they can't go to work without this card. They need a CPR card. I didn't even know what cardiopulmonary resuscitation means. So for you, it's gonna seem elementary, but what is cardio? What organ? Pulmonary, what organ?
Lungs.
Your students may not know that, so please take the time before you start and explain that to them. All right, so restrooms, we have a one-way in, one-way out. Restrooms are all the way down the hall. As if you're going to exit, you'll see a hall near the glass doors, and that's where the restrooms are. I have coffee, oodles and noodles, crackers, and some water over here in the nourishment area. You have to pass the mannequins in order to get into the kitchen, okay? Any questions? All right, let's take our 10-minute break. Great job, everybody.
Yeah.